Hello guys, this is the first part of the coagulation pathways. It's going to be we know there's two ways, the intrinsic and extrinsic pathway. So first of all, for the intrinsic pathway, it means within the vessels. Like something is called the SEC, which is subendothelium coagulant, or the high molecular weight, and also that Coagulation, I guess it has this name. Anyway, for those as as a factor or receptors for it, the subendothelium cells and the high molecular weight, it leads to activate coagulative factors. The coagulative factors we have in our body, like 13, which is mentioned in the book. You don't need to memorize them all, just for the pathways, that's it. So first of all, the subendothelium coagulant start like activation of the coagulative factor 12, and then it will lead to activation of the coagulative factor 11. After that, leads to activation of the coagulative factor 9. After that, 8. After that, 10. 10 is much important because it's common between the intrinsic pathway and the extrinsic pathway. So once it activated the coagulative factor number 10, that will lead to activation of the prothrombinase enzyme. And that, in the enzyme, it's like, if you want to mention, like calcium plus XA, if you want to mention. If you don't remember, it's not that a big deal. So the prothrombinase enzyme will lead to activation of the prothrombin. Prothrombin, as we know, before the thrombin. And after that leads to thrombin. We have the thrombin, and then leads to activation of the fibrinogen, which is the last step of activation of the fibrin. That's the brownie thing after you had like bleeding or injury. So from the beginning, really quick, let's recap. It's just you have to memorize the steps, that's all. So first of all, like within our vessels, there is something or some like problems happened, and there is like bleeding, and your body started like react to stop that bleeding. So first of all, something is called like subendothelium coagulant. If you don't remember those things, it's okay. It leads to activation of the factor number 12 in the intrinsic pathway. So the factor number 12 leads to factor number 11. Let's see here, 12 by these numbers, and then 9, and then 8, and then 10. Once it become in 10, so it will lead to activation of the enzyme. It's called prothrombinase enzyme. And then this enzyme will activate something like before the thrombin body. And after that, the thrombin body formed. And then it leads to fibrinogen and then fibrin. You can say from the thrombin to fibrin is correct, or from the prothrombinase to thrombin, like from here to here and from here to here, without mentioning this one and this one. It's up to you. So this is for the first pathway. And also let's discuss a little bit about what is the difference between the intrinsic pathway and the extrinsic pathway. Where's the extrinsic pathway? From the name, intrinsic pathway, which is within the blood vessels. Extrinsic, which is outside the blood vessels. Like here, I told you, there is something inside the vessels. Here, maybe trauma or injuries from the outside. It starts with the factor number 12. Here, it starts with the factor number 7. Here 7, here 12, coagulative factors that we talk about. And also, this one is long, this one short. This one is effective, most effective, but here it's short but less effective. So that's all for the differences between the intrinsic and extrinsic pathway. I hope this video it was helpful for you guys for better understanding. Thanks for watching. If there's something not clear, so you should comment me in the comment below and let me know, and I will try to explain it more. Thanks for watching.